evening hour with you, talking about our products and our business and how to best position ourselves in order to share our products and our business with those with whom we interact. So, from wherever you are, it's a very warm welcome. I hope that you are going to find today's session interesting, especially because today we are doing Q&A, as you might have seen from your invite. And as you may have noticed, if you are with us regularly, we are trying to keep on top of the questions that you are interested in. So because we have got quite a number of questions today, I want to make a good inroads on the questions that we have. So right away, I'd like to start. So I invite you to relax and spend the next 1 hour with us. The first question that I received was from maybe 2-3 weeks ago. We've been lagging a bit with the questions. Was someone who wanted to know about what to recommend for endometrial overgrowth. So endometrial overgrowth means that the cells of the uterus, which are supposed to be in the uterus, start growing and proliferating in other parts of the abdomen. The cause of this has not yet been well established. Some think it runs in families, some think it is to do with hormones. But we do have products that we can recommend to help people to manage this condition. And the first will be feminine herbal complex. And this is because the hormones, if in case the hormones are out of balance, this particular herbal preparation from Neolife is going to help to stabilize the hormones of the lady. We also recommend omega-3 salmon oil. This is going to help to resolve the inflammation that tends to accompany the condition. And we also recommend multimineral alfalfa, which is a broad range mineral supplement. This is going to help with replenishing the minerals for the sufferer, because one of the things that accompanies endometrial overgrowth is heavy monthly bleeding. So those are the three products that we recommend for these particular conditions. And if maybe the person takes the opportunity to observe what maybe makes things worse, and they can try to avoid, if possible, the things that maybe make the bleeding worse or makes the cramps worse. If the cramps are very problematic, we can also add Calmag. Calcium tends to help with solving the muscle cramps that accompany periods or endometrial overgrowth also. So then to the next question. Someone, I think this came after our session on oral health. Someone wanted a recommendation for a good toothpaste. Unfortunately, I find that maybe most of the toothpastes are kind of the same. So what I would recommend is not a specific toothpaste, but simply to say choose any one. I would say one that does not have a lot of sugar. Some of them are very heavily sweet, and if children are using, they are often tempted to swallow the toothpaste, which is actually the problem. So do not swallow the toothpaste. And I might also add that when we, in the initial days of our journey in Neolife, when we were hard up for cash, what we used to do is actually use diluted LDC to brush our teeth. So just to say that I'm not going to recommend any brand of a toothpaste, I'll say choose your preferred one, preferably one that is not too sugary, and then avoid things that can stain your teeth or support cavities. Of course, the toothpaste that have got a lot of sugar are problematic in this, because sugar, as you'll remember from that session, is one of the things that contributes to cavities. So you would not want your toothpaste to be contributing to your dental problems as well. So avoid things that stain teeth. This will be things like coffee, cigarette smoking, and so on. If you take care of that, you may find that if you have problems with toothpaste, you can actually be able to simply brush your teeth well without toothpaste. Some people use salted water to clean their teeth. So I would also just like to remind you that people from our continent were always very famous for having very good white teeth long before we had toothpaste, which means it's actually not essential for white clean teeth. But we are having a lot of things that we are taking now that tend to stain our teeth and makes us need to use whiteners and all this other stuff. So that is what I can share in that question. Sorry, I'm not able to give you any, but I would say that just choose what you prefer and then take care of your teeth and your oral health as per our session on that topic. Then the next question, someone wanted to know if a broken tooth that did not come off altogether can cause infections in the mouth. And this is actually a real possibility because a broken tooth, depending on how it has broken, might make cleaning the mouth and the teeth more difficult because the broken tooth provides corners and nooks for food particles to lodge into and may not be so easy to take out. So if the damage to the tooth is serious, it may be better to have the tooth extracted. If it is simply cracked or maybe chipped, then I think that you can go on with it like that if you don't want to do anything about it. And then a thing that you can do is make sure that you do, I don't know how you call it in English, when you put water in your mouth and you shake it inside your mouth to make sure that any particles that are left behind are dislodged and removed from your mouth. So if the damage to the tooth is serious, I think consult your dentist so you can decide what is the best way to go forward. If the damage is not serious, then I think simply just take care of oral hygiene and avoid foods that contribute to breaking down the health of teeth. Then another question I had still under oral health was what to use for gum infection in order to avoid tooth loss. I think we mentioned this in the session, but just to repeat, the first is if you have maybe already a gum infection, then the best is to see a dentist in case antibiotics are required. Then, of course, recommend good dental hygiene, brush your teeth in the morning, and especially make sure that before going to bed, you brush your teeth well and clean your mouth as best as you can, because during the night, the dental hygiene is even more important. While we are asleep, the movement of saliva within our mouth, which helps to clean the mouth, will have almost stopped or slowed down. On top of that, it is a time, if let us say we sleep with our mouth open, it can be a time when bacteria make their way into our mouth. So dental hygiene in the morning, but especially be even more careful about cleaning your mouth and teeth and tongue at night before retiring. Then minimize processed carbohydrates. These undermine the health of our teeth themselves. So even as we are taking care of, just give me one moment, please. Even as we are taking care to keep our mouths clean, we should not add problem foods that is going to neutralize our efforts. Then the supplements will play an important role here. The first that we recommend is Calmag. Calmag is, as calcium is an important mineral for teeth, and magnesium helps in the absorption of making sure that we absorb as much calcium as our body needs. We also recommend vitamin C. Vitamin C helps in calcium absorption and also keeping the membranes of our body healthy. So it will be important there. Then we also recommend vitamin A plus D. Vitamin D, another one that helps facilitates the absorption of calcium. So those three supplements will play an important role in the health of your gum and to save the problem of tooth loss. Then the next question was someone wanted to know what to do about receding gums. So receding gums can be something that is age-related, and reversing it in older people may not work very well. So I think the best thing is to start early and take good care of our gums and teeth in order to prevent the recession of gums, which is also associated with poor oral health and can worsen infections in our gum. So good oral hygiene to avoid gum disease is important. Then avoid aggressive brushing. So we should brush thoroughly, but not aggressively. Get a good toothbrush, not too hard, also not too soft. And then brush thoroughly, but not roughly. Then avoid habits like cigarette smoking and sugary drinks, chewing tobacco, and so on. These tend to lead to gum problems. On the supplement side, very important, flavonoid complex. You remember flavonoid, apart from having phytonutrients, it also contains some vitamin C. So that will be our recommendation for gum health. We also recommend vitamin A plus D and CalMag once again. Then the next question, now leaving the side of oral health, someone wanted to know what to recommend for high blood pressure. So as usual, we first mention some points about lifestyle. So one thing we can do if we have high blood pressure is to increase activity in our lifestyle. So if you have a sedentary job, try to be deliberate about including plenty of movement in your day-to-day life. If that is not possible, at least make time to walk for a minimum of 20 minutes. And then we also recommend eliminating processed carbohydrates, factory fats, and junk food from your diet. And we recommend you opt for healthy fats. This will be fats that you get from avocados, olives, things like butter, coconut oil, and so on. And make the majority of the food in your diet minimally processed, traditional foods. Then we have important supplements that help in resolving high blood pressure. This will be either omega-3 salmon oil if your budget is tight. If possible, Provitality. Provitality contains omega-3 salmon oil as well as threonine, carotenoid complex, and multi. So if you can get Provitality, then that is good. If maybe the budget is tight, at least omega-3 salmon oil. Then because we have two other products that are important, this will be lipotropic adjunct and garlic allium complex. So the three will be either omega-3 or Provitality, and then add to that lipotropic adjunct, which is a combination of nutrients that play an important role in the health of our blood as well as our blood vessels. And garlic allium also plays important roles in that case. From time to time, if you stay with our training sessions, we do have an entire topic where we deal with heart and blood health, blood and blood vessel health, so that can touch on the topic more thoroughly. Then someone wanted to know what to recommend for hepatitis A. So this is a viral infection that affects the liver. It usually will originate from eating contaminated food or water. And what we recommend first is to see a doctor in order to get medication. And then we also recommend that as you continue with your medication, to also add vitamin C or flavonoid complex. One of the two will do. And then vitamin B complex to support the liver in healing. And we also recommend garlic allium, which is going to also help in getting rid of the microbe that is causing the hepatitis. Someone wanted to know what to use for because of forgetfulness, what they can use because of they find that they are forgetful. So here, the first recommendation on the lifestyle point is to safeguard a minimum of 7 hours of sleep. When we do not get enough good quality sleep, what we find happens is that our mind is not as sharp as it could be. And one of the things we'll notice is that we tend to be forgetful and not able to focus very well. So safeguard your sleep. And then we have got 4 products that I'll recommend. One will be Mind Enhancement Formula. Then we recommend threonine, omega-3 salmon oil, and magnesium complex. So those 4 are going to support the health of our brains But remember that we need to safeguard our sleep, and also we need to resolve stress, because one of the things that interferes with good sleep is stress. And one of the things that gives us problems that originate from our brains is lack of sleep, because during deep sleep is when our brain gets the opportunity to detox. So if we are never or rarely getting good quality sleep, then the byproducts of our brain activities will accumulate, because we are not giving the brain a chance to detox. So it's very, very important that we safeguard a minimum of 7 hours of sleep. 7, 8, or 9 is adequate. It differs from person to person, but the minimum is a young child with type 1 diabetes. Here, some lifestyle recommendation will be you'll need to get a blood sugar monitor, because you need to keep an eye on blood sugar levels. We also recommend giving the child healthy, nutritious foods rather than junk food or fast foods. And then we also recommend that a person with type 1 diabetes, because we're talking about type 1 diabetes here, should be under the care of a doctor, so that they get insulin. Because remember that type 1 diabetes requires insulin, because it is caused by the cells that are supposed to make insulins are either not working well or are not producing enough insulin. So it is important to have a medical practitioner who takes care of this person. On the supplement side, we have recommendations. Botanical Balance, which is a very important product for diabetes, both type 1 and type 2. It helps the body in the area of sugar metabolism. We also recommend Magnesium Complex is our second recommendation, followed by Tri-NN and Vitamin B Complex. B Complex is very good for energy production and a lot of other processes. So those 4 will be what we recommend for a young person with type 1 diabetes. The child needs to be taught how to monitor their own blood sugar and how to stick to a good diet that supports good health. It is possible to live a fairly normal life with type 1 diabetes. And so with the supplements, I think they should be able to get on well with support from family and the medical practitioner. Then another question was about paralysis. So here we recommend on the lifestyle side to see therapists, either an occupational therapist, if maybe the person has lost certain abilities. We also recommend a physiotherapist to help with certain exercises that they'll be able to gauge as useful. Recommend as well massage, because paralysis means that the muscles will not be moving as much as they should, and can lead to muscle loss and loss of strength. So massage will help with ensuring circulation is taking place well in the areas affected. And also sun exposure wherever possible, or supplementing with vitamin A plus D or vegan D. Then we recommend supplements, omega-3 salmon oil, wheat germ oil, and then we also recommend vitamin B complex and magnesium complex. So if wheat germ oil is not an option, it's a fairly large capsule. If the person struggles with the large capsule, if let's say the paralysis affects the ability to swallow, then we can also recommend instead vitamin E. So wheat germ oil contains vitamin E. And if you're not able to use that, we can use vitamin E itself. It's a much smaller capsule. So that will depend on whether the paralysis affects the ability to swallow. Vitamin B complex is also a large tablet, which I think in this case, we can say maybe we can cut it in half if swallowing is difficult. We can also get the omega-3 salmon oil minis, which is a smaller capsule compared to the omega-3 salmon oil 90s. So then another question was, someone wanted to know the difference between vegan D and vitamin A plus D, and whether they need to take both. It's not really necessary to take both. The difference is that vegan D is made from non-animal sources. So this is especially important for people who are either vegetarian or vegan. That is, people who do not want to take animal products. So vegan D gives them the option to supplement with vitamin D without having to take animal products. Vitamin A plus D is made with fish cod liver oil, and so it has got animal products, but it's also very good. So depending on your preference, if you're a vegetarian or a vegan who wants to eliminate animal products from your diet altogether, then use vegan D. If this is not an issue for you, you can use vitamin A plus D. So I hope that that answers that question. You do not have to take both. Then, okay, also remember I say that we need to supplement with vitamin D, especially if for one reason or another we do not get sun exposure. If you spend long periods in the sun, most probably with the parts of your body exposed, like your arms and legs, face, and so on, most probably you will be able to get the majority of the vitamin D that you need from your skin manufacturing it when it's exposed to the sun. If, however, for whatever reason, you are not getting enough sun exposure, then it's a good idea to supplement, because vitamin D is being found to be very, very important in very many processes in our body, and it helps with very many illnesses from in a variety of our body systems. Another person wanted to know what to recommend for someone who has suffered a stroke. So here again, I will recommend consult a physiotherapist in order to help regain any lost abilities, and also to get exercise to combat the effects of the stroke. Then we recommend lipotropic adjunct, vitamin E, and Pro-Vitality. So that is what we recommend for stroke. Most times it may not be possible to reverse all the effects of the stroke, but I always say, even if we're not able to reverse the effects of a stroke, it is important to prevent any future strokes. Because once a person has had a stroke, they become high risk for getting more strokes. So by using the supplements, you are going to help your body to be in the blood and the blood vessels to be in better health, so as not to get another stroke. And with the help of a physiotherapist and medication, it may be possible to regain some of the lost abilities. Another question was about varicose veins. These are the thick veins that appear on the surface of the skin. They tend especially to be on the legs. And this runs in families. And once they are formed, it is not easy to reverse them. So unfortunately, this is one where, as far as I know, the reversal through supplements does not happen very well. What if the varicose veins are very prominent and problematic, then surgery is usually the only way to deal with advanced cases of varicose veins. So if you have a family history, maybe someone in your family has had varicose veins, I think the best thing is prevention by incorporating walking and activity in your lifestyle. You can use compression socks, which are compression stockings, which are those white stockings that you can get at a pharmacy. If you need to travel, let's say by plane for long distances, and you'll be sitting for long periods, if you travel a lot in this means, you may want to use compression socks to ensure that blood does not pool in your legs, which can worsen the varicose veins and make them painful. Then if it's still in the early stages, we can recommend flavonoid complex, omega-3 salmon oil, and multimineral alfalfa for varicose veins. Then someone wanted to know what to recommend for plantar fasciitis, which is a condition where one gets pain in the heels. This especially can be when you get up first thing in the morning, or if you get up from bed and maybe you need to go to the bathroom or to do something, you get sharp pain in the hip. This is as a result of inflammation of the tendons and the fascia in the foot. So one thing that can contribute to this problem is having overly tight calf muscles. So the muscles on the leg, if it becomes very tight, it can cause the foot to not move very freely. And this is what leads to that inflammation. One of the things that leads to having a tight calf muscle is wearing high-heeled shoes habitually, so that after a while, the muscle becomes tight and shorter. It can also be as a result of injury or in a problematic gait, or habitually walking in a way that is making the foot not operate properly. The mechanics of the foot is actually a very interesting and important thing in our overall health, but especially in terms of being able to move without pain in the ankles, the knees, and the hips. So my recommendation will be to consult a physiotherapist for exercises and stretches to relax the calf muscles and the foot. And then also you can do self-massage using a tennis ball under the foot and a foam roller under the calf muscle, so that the tightness loosens. But a physiotherapist would be able to advise you on the specific exercises. Then we recommend you use omega-3 salmon oil to reduce the inflammation in the foods. We also recommend flavonoid complex and vitamin D if you are not getting adequate sun exposure. Then someone wanted to know if it is safe to use N during pregnancy. And the answer there is yes. N is an important supplement for pregnant, expectant ladies. And it is made of concentrated oils and nutrients from grains and legumes. And these oils are usually deficient in our diet because they are removed when these foods are being processed, especially when they are being milled into flour. So N is going to put what you would have been getting from your grains and your legumes. Then I think this will be my final question. Someone wanted to know what to recommend for a condition called lichen sclerosis, which is the loss of skin strength and skin pigment. And it is unfortunately autoimmune, as you may remember from other times. We have had a question on things like vitiligo, which is another one where one loses pigment from the skin. And as with autoimmune conditions, the immune system is attacking the body. So we'll do things to keep from agitating our immune system. Look at your personal care products. They should be mild and avoid things like perfumes and so on, because some of them are made from chemicals that tend to agitate our immune system. Also take care of the gut health, because autoimmune problems start from a gut that is not working well. So eat fermented food from your culture, and also eat a healthy diet containing plenty of leafy vegetables and fruits and so on, so that your gut is working well, and preventing things from leaking out of the gut into the blood circulation, because that is how the immune system starts attacking our own tissues. Then we recommend the following supplements: Pro Vitality. We also recommend chelated zinc, and recommend vitamin A plus D. So the Pro Vitality is going to help to support, the Pro Vitality and zinc help also to support the immune system to function well. Next, there was a question of someone, I think I'll take one more minute. A question, someone wanted to know what to recommend for tremors. Unfortunately, there wasn't information about what is causing the tremors, whether it is something like Parkinson's or something else. But my first recommendation, again, would be to see a physiotherapist. They might be able to help. Also, they'll help. You can also learn how to do breathing and relaxation techniques, which can help to reduce the tremors. We recommend from the supplement side, vitamin B complex, magnesium complex, and also vitamin A plus D. So I think that I will stop there for today. I know that I may not have reached your questions because there are still some questions left, but as you know, if you want the question answered maybe for a client that you want to attend to urgently, then simply send it to my number in a direct message. I will send you a reply. Also, we do a Q&A session fairly frequently, maybe twice a month or so. So if I did not get to your question this time, I'm sure we'll get to it next time. So I want to thank you for spending your time and your data in our training session for today. And I want to wish you a very productive rest of the month of September as we move towards the last days of this month, that we may be able to achieve our goals, because whenever we achieve our goals, it also means that someone is either improving in terms of health or financial freedom. So thank you very much. And let me hand you back to Pascal, who is standing by to take you through the business session for today. Thank you and good night. So Pascal, you take it away.
Yes, thank you very much. I think the human body has got so many different needs, and there seems to be endless conditions that we go through. So it's very exciting to hear those very many questions attended to. The session I want to discuss with you today is one of the most important business principles we have in our business. That is called duplication. What is duplication?